Hi, everyone. This is Ken with Ken's Insurance Agency. We're a full insurance brokerage. We're coming to you today to talk to you about health insurance. This webinar is going to be focused on commercial insurance. We will be doing another one shortly after this for health insurance for the individual and family, and then we'll be doing our Medicare and a couple other webinars. So please be checking back with us. These will also all be uploaded to our website, to YouTube, and to Facebook. So please be checking in there. Um, One thing about commercial insurance is that, as far as on the health side and benefits package side, is that you can only enroll in it and change at certain times of the year. It's true that with a cafeteria plan that you like your employees in for a 12-month period, and a lot of employees like this at first because of how it's presented as to saving tax dollars, but it hurts the employee also. And it can cause an employee to want to leave your work, especially when they start trying to collect on things like an accident plan or hospital indemnity, and they're getting taxed on it, on the money that they're getting. So they're getting less than they actually thought that they was going to get, and what they need. So it can hurt them. Best to talk to a broker that is not aligned with anybody pushing cafeteria plans like myself and my agency, and let us guide you as to the best time to use a cafeteria plan and the best time not to. With If the owner wishes to change the plan in the middle of the year, he can do so and end the cafeteria plan on his own. So do not let the cafeteria plan mislead you. The agents that are pushing cafeteria plans will tell you you can't, but you can. There are loopholes that allow it, but it has to be the owner of the company initiating it or the employee leaving. Um, when it comes to healthcare for companies, there are three basic types. There's the ACA plans, which are sold by your big name insurance companies, mainly like Humana, Aetna, Cigna, UHC. Um, and then you may have some off brands that sell also. We sell these, and we are a broker for these, so we can help you with these. These cover pre existing conditions from day one. Um, they are ACA compliant, um, and they can be very beneficial to you. But their downside is they are very costly. Um, when it comes to the next type, it's the ACA alternatives. And basically, ACA is also known as Obamacare or the Affordable Care Act or the Exchange. So those may be names you know it by. ACA alternatives have pre-existing condition clauses. So um, the best way to explain it is, if you got a pre-existing condition, depending on the pre-existing condition, it may be excluded for 12 to 24 months. Some companies and the companies we represent exclude major things like mental disorders, a lot of heart disease and stuff for 12 months. We don't like the ones that exclude for 24 months. Most people can't go 24 months. They might be able to work it out to go 12 months if you got an option for them to help them. On certain pre-existing conditions like type 2 diabetes, high blood pressure, high cholesterol, glaucoma, cataracts, these kind of things, they may put a time period on it where we don't have to rate up, like glaucoma and cataracts is a 12 months. So if you haven't had any treatment for it for 12 months, then we don't have to rate up for it. Some of it you're going to basically have ongoing treatment, whether you're taking medicine and seeing a doctor for it or whatever. So those, it's a rate up, determined by the company as to how it's rated up, but it is a rate up. So for that employee, they would have a little higher premium. The next type, which covers pre-existing conditions from day one, is called a self-funded plan. This is where basically you're putting money into the plan to cover the medical expenses, and basically the company pays it out. Now, your medical expenses are covered from day one at whatever the plan is set to cover. So, whatever the deductible is, you got to meet. Whatever the co-pays and co-insurances are, you got to meet, but it covers pre-existing conditions from day one. Now, this is very big. I also want to tell you a little bit more about the ACA alternative and the self-funded plan. These plans, somebody's going to get money back off of them. So basically, the ACA alternative plans, when a person goes into a PPO hospital and has a procedure done and is in the hospital, chances are they're going to get a check back from the insurance company for the unpaid or unused amount of the benefit that's allowed for the plan. So the employee benefits from it, and it helps the employee. Now, with the self-funded plan, the way that works is you go through the year. After your 12 months is up, you'll have another 6 months where any claims within that 12-month period that came in at the last minute are being paid. Once those claims have been paid and everything's been adjusted, then any unused money that's in the account will be paid to the company. And the company can use this money any way they wish. But what we try to have them do is use it to invest in their employees. So basically, like they may have us already sign their employees up for an accident plan, a cancer and critical illness plan, a hospital indemnity, dental and vision. And what we may have them do is look at taking that money and paying at least for the employee one of these plans, and for the year. And basically, if they have any extra left over after they pay these plans, then maybe they stick it into the employee's retirement, or they can use it for anything else that they want. So we are trying to help them build client loyalty. Also, remember, the more robust your benefits package is, the more your employees are going to remain loyal to you and help you. Okay. The second thing is that the more robust your employee benefit package is, the less likely your employees are going to have to come to you and ask you for money for legal events or for health related events and stuff. So that helps you also. It also helps you when you're hiring because the more benefits you have to offer, the happier the new employee possibilities are going to be to want to work with you versus the guy down the street doing the same thing, paying the same amount you are, but has fewer or no benefits. So this is very important. And we have very affordable options. The next sets of benefits that you can have in a benefits package is group Medicare. Group Medicare is for your turning 65 and older that are retiring. Special options are available in group Medicare depending on the company that you go with. We do offer this. Not all companies offer group Medicare, so that's one thing to be aware of, but we can help with this. And it gives a way to also move your employees that are at retirement age off of your health insurance to keep your health insurance premiums low while still providing them with benefits. The next type of benefits are your supplemental benefits. That's going to be dental, vision. We even have a dental, vision, and hearing policy. Then you have your hospital indemnity, your accident, your cancer, your critical illness, and your disability, which pays if certain things happen. And we help you with everything from we will do the enrollment once we complete the enrollment and have everything submitted to the insurance company. We'll help you with knowing what to deduct from each employee's paycheck to what was put on a cafeteria plan and what wasn't, and so forth. Also, in this, you can have life insurance and your retirement. We will be honest with you. The retirement, we're not as crazy about putting on a cafeteria plan because that pre-taxes it. It's best to have it post-tax. We recommend annuities instead of the traditional 401ks and IRAs and simples. But we can do the traditional plans, but there's many downsides to them. One, they don't usually last but about 3 to 7 years, and then the employees having to go back to work or live on Social Security. They're heavily feed both for the employer and the employee, where an annuity would not be. So there's many options. The life insurance, the way we do the life insurance and the annuities also, it is portable. So that's one thing to remember. So you want to realize when is the best time to do a cafeteria plan, when it's not, and all. So basically, like your retirement, your ancillary products, which would be like your supplemental health products. You really don't want to do cafeteria plan on them. That's where you hurt your employees. The next type, we're going to actually look at some videos for the next two types. These you can use a cafeteria plan on.
Hello from Legal Shield. We believe every commercial driver needs legal protection, but first things first. What is a commercial driver's legal plan, and why should you want it? Quite simply, the commercial driver's legal plan gives you access to lawyers for transportation-related issues at an affordable rate. Attorneys are, well, expensive. $250 to $500 per issue expensive. But with the commercial driver's legal plan, you get access to our commercial driver's provider law firm for about $400 a year. That's a pretty easy choice. If you use a lawyer, this probably all sounds great. If not, you may be wondering, why would I even need a lawyer? It turns out that lawyers can help you with all kinds of transportation issues that you may not have even realized. Things ranging from moving and non-moving violations, DOT, Department of Transportation violations, license reinstatement, tragic accident representation, CSA consultation, and much more. Whatever transportation issue you may be facing, a lawyer will help you make the best decision for you, your spouse, and your motor vehicle record, or MVR, in the future by knowing your full legal rights. That's always a good thing. So legal protection is a smart choice. Now, why choose Legal Shield? For starters, Legal Shield has been in business 40 plus years and helped over 1.5 million families that trust Legal Shield as their legal protection provider. Legal Shield has partnered with a law firm that gives you access to lawyers who can answer your transportation legal issues when you need them. So you'll never have to worry about what lawyer to use, since we've already done the legwork for you. And you'll always get an experienced lawyer who is dedicated to helping you in the state where your legal issue occurred. Just pick up the phone and you'll be connected to a customer service representative who will take your issue, and within 5 business days, you will have a lawyer's name and number for you to be in contact with. Remember, communication with your lawyer is key, and in most cases, your lawyer can represent you in court without you having to be there. There's a waiting period of 10 days, but our lawyers can still help you, even with your transportation needs during that time, at a 25% preferred member discount. Is good, and Legal Shield is the best. Now let's talk about your specific plan. You can enroll in Legal Shield for a low monthly fee determined by the plan you choose, along with a one-time enrollment fee of $25. Special pricing is available for drivers who enroll in the plan as part of an employee group. Your membership includes help with moving and non-moving violations, DOT violations, license reinstatements, tragic accident representation, transportation law, CSA consultation, and much more. This specific plan covers you and your spouse or domestic partner in personal or commercial vehicles. With Legal Shield, you're in a position of power with access to a dedicated lawyer whenever you need it. Legal plans are also available for family coverage. Just see your independent associate for more information. Protect your ability to earn a living. Become a Legal Shield Commercial Driver's Legal Plan member today.
Now, the reason I showed you that one is because if you have employees that are driving basically a vehicle with your company logo on it or your company name on it, then you will need that plan covering them, and you can offer it as part of a benefits package. The next is for you as the business owner and all your employees for personal. And then you'll need this also for business, which we have special business.
Every year, millions of people face legal issues. And let's face it, lawyers are expensive. But as a Legal Shield member, you pay an affordable rate for an entire law firm versus high hourly legal fees. Legal Shield's law firms have over 20 years of experience in many areas of law. As a Legal Shield member, you'll have direct access to one of our dedicated law firms, so you can take proactive steps to protect your legal rights, such as having your rental agreement reviewed or your will prepared, and receiving legal guidance for things like dispute or creditor. Your law firm can also write a letter or make a phone call on your behalf. When you have a legal question or issue, you can simply call your law firm and a lawyer will return your call within 8 business hours or less. They're even available 24/7 for emergency situations. And with the Legal Shield mobile app, you can call your law firm at the touch of a button, access legal forms, upload your speeding ticket for review, and have your will prepared. Legal Shield makes receiving legal assistance easy and affordable. So get the legal protection you need and deserve, and put a law firm in the palm of your hand with Legal Shield. Every year, over 10 million people have their identity stolen. Take control of your identity with ID Shield. ID Shield monitors your personal information, such as your social security number, credit and debit card numbers, and social media accounts. We watch across the internet, including black market websites, government databases, and court records. We even provide child monitoring and monthly credit score tracking, which you can track right on the ID Shield mobile app. If any discrepancies with your identity are found, you'll receive an alert. If your identity's been stolen, a dedicated team of licensed private investigators are there at the touch of a button 24/7 to restore your identity. If identity theft happens, we'll do whatever it takes for as long as it takes to restore your identity. Shield yourself and your family from identity theft and put a licensed private investigator in the palm of your hand with ID Shield.
And there is special pricing on the Legal Shield and ID Shield, both for the individual / family and the commercial driving when sold as part of a benefits package.
A Real Money Team is back, saving you a lot of money on your doctor bill. Americans, on average, spend up to $200 for each doctor visit. So imagine being able to visit your doctor without leaving home and cutting the cost in half. ABC's Paula Ferris with a way to keep that money in your pocket.
With 3 growing boys, the Allspaws from Dayton, Ohio say their home away from home is often the doctor's office.
We really do have a stack of medical bills, and it overwhelms me.
For the boys, $90 each visit, $100 for mom and dad, and the costs are adding up.
Just wondering, is there a better way?
According to our healthcare consumer advocate, Michelle Katz, there is. It's a brand new high-tech medical service.
Hi.
But for most families, Michelle says they don't even know it's an option or figure in the extra costs.
It costs money to take off from work, to get all the boys in the car, drive down, to wait a few hours to get a diagnosis that you might already know about.
It's used to treat minor ailments like cold symptoms, which alone account for nearly a quarter of family doctor's office visits.
It's starting here.
Phil's trying it out for what he thinks is poison ivy.
Well, it'd be $100 just to tell me that I got the poison ivy that I know I have.
Taking a picture,
I have the picture.
uploading it, and answering a few questions. An hour later, Phil gets a call from a doctor, a prescription, and fills it at his pharmacy.
We've got a very affordable alternative to an emergency room for non-emergent care.
Dr. Howard says telemedicine is to help families stay healthy in between regular doctor's office visits. In all, Phil's bill was about half of what it usually costs him to visit the doctor's office. And Michelle estimates the Allspaws can save more than $2,600 just this year.
I'm amazed. I am simply amazed.
That's real money!
Sometimes it takes a little while for a new idea to catch on, but when it does, watch out. Just look at Teladoc, TDOC, the world's largest virtual healthcare provider. We've been following this story for over a decade, ever since Teladoc was still a tiny startup. I've always thought it had an amazing concept. Let people have video conferences with doctors. You shouldn't always have to go to the doctor's office to get medical care. Hey, sometimes you get sick when you go to that office too, let's face it. Not long ago, Teladoc came public, 2015. The stock quickly went into free fall, plunging from the 30s to the single digits in a matter of months. Since then, though, it's been a rocket ship, a deserving one. Last year, Teladoc more than doubled. It's up more than 60% just from 2018. Now we're in a situation where the results are speaking for themselves. Plus, just last week, the company announced that it's buying a competitor, Advanced Medical, and its stock shot to new highs. Let's check in with Jason Gorevic. He's the CEO of Teladoc, to learn more about this deal and his company's prospects. Mr. Gorevic, welcome back to Mad Money. Good to see you, sir. How are you?
Good to see you.
All right, I got to tell you something. You should be very pleased by what I'm about to tell you. I posted in this morning on my Twitter file that what are people's experiences with Teladoc. I have, most people are very critical on Twitter. There was not a single negative experience. It was just positive experience after positive experience after positive. What are you doing?
You know, it's funny you say that. I used to run health plans. I got a lot of hate mail when I ran health plans.
I figured I'd get a lot of hate mail when I put your name up.
Now I get fan mail. Maybe not as much as
tell
you,
me
but
about
I get
that.
a
I
lot
love
of
this
fan mail.
contrast.
No, it's great. It's we're delivering care to people where they need it, when they need it, on their terms, right? And that's how the healthcare system should work. And it's nice. Consumers are understanding it. Payers are understanding it. Employers are understanding it. And we've been fortunate to be the beneficiary of that.
One of the tweets was someone got sick in the car, pulled over, called, got a diagnosis. Can it be that simple?
Oh, it really can. Yeah. I mean, you know, technology being what it is, we can now match a doctor with a patient in their jurisdiction where they're licensed, matched up with their specialty, and take care of them in a matter of minutes. And, you know, look, people get sick not on regular schedules.
Right. Now, it is 24/7. Also, this new acquisition, to me, makes you the worldwide leader.
That's exactly right.
Did you know that in the course of a year, you'll see your doctor close to 3 times for one of these typical conditions? And for your kids, almost 4 times. So what do you do about it? You normally have 3 options. The first thing you should do is call your primary care physician. But what if getting an appointment takes too long? Or even worse, what if traveling makes it impossible? You could head to an urgent care clinic, but do you want to spend $150 to wait in a room that might be full of sick people? And that will cost $50. And the waiting room might be full of really sick people. Wouldn't it be great if treatment could be simple? That's what Teladoc is for. This is how easy it is to use. First, sign up and fill out some health info. When one of these strikes and your doctor is unavailable, go online or call Teladoc to request a consultation with a U.S. board certified doctor. Get on a call or video chat with your doctor who is licensed in your state. Explain every detail of your issue. There's no rush. Take as long as you need. The doctor will listen carefully. And when enough details are given, we'll diagnose what you have. A prescription is sent to your local pharmacy if necessary. All of this was done in less than an hour. Average amount of practice experience with Teladoc doctors, 15 years. Average time it takes to get a call back from a Teladoc doctor for quality care you need, 22 minutes. 91% of all medical issues resolved. 97% of customers satisfied. Who said getting quality care has to be complicated? Try it once. You'll love it.
What is that?
A bottle.
A bottle. What's in the bottle?
Nothing.
Nothing's in the bottle.
Me? Mom! Mom, come on.
I'm still working. I just need more help from you.
I'm doing the best I can.
I feel like everyone is leaning on me to do everything, Mom.
You know, it wasn't always easy with you and your dad either. But you're losing out on moments you aren't going to get back. Maybe it's time you talk with someone.
Hi. Thanks for seeing me.
I'm glad you scheduled some time. How can I help? Make some mental notes, and we can talk about it next time.
Thanks, Dr. Brown. Let's meet next week. This castle is a dragon, huh? Arr.
They're finally asleep. How are you?
I'm good. I think we're gonna be all right.
Is really that simple to do.
Do you not have insurance for prescriptions? Not enough coverage? Are you not getting the medicine you need for care because of the cost? Despite for almost a decade, chain pharmacies nationwide have been selling select generic drugs for as little as $1 per week, medicine cost is still a burden to households across the United States. Our program will lend you a hand. Now that you have access to the doctor with our teledoctor service, let's get the prescription worked out. If your insurance plan does not cover the cost of all your medications, or if you do not have insurance and you choose the cost-effective generic drug route, either way, our plan will drive down the out-of-pocket expense. Get discounts at over 58,000 national chains, regional chains, and independent pharmacies. Get 20% to 60% off retail prices for generic drugs and 20 to 40% of name brand drugs with no limits on quantities. Use mail order pharmacy as well and purchase up to a 90-day supply of your maintenance prescriptions. Our membership card is the gold standard for prescription savings. Enroll today. I know what the next question is about: vision. Don't worry, we have the answer. Your healthcare savings plan also includes 15% to 35% off normal retail prices for frames, lenses, and specialty items, such as resistant coatings and ultraviolet protection. Contact lenses and even LASIK and PRK procedures also receive discounts,
up to 15% off retail prices as a matter of fact. This keeps money in your pocket should you need glasses, contacts, or ophthalmology services at any time. Just present your membership card and save all around. Enroll today.
If you don't have a roadside assistance plan for your car, you may want to get one soon. One of the most common things we never think about until it happens, transportation issues. The winter and fall months are when most drivers need help with such issues as dead batteries, flat tires, and keys locked inside their car. Spring and summer are filled with road trips and more time behind the wheel. You could miss work, family activities, important dates, never be stranded again. In our package, you have access to emergency road service 24 hours a day, anywhere in the US and Canada. We deliver gasoline, change tires, provide jump starts, unlock the vehicle, winching and extraction services, and delivery and installation of parts. We'll also tow your covered vehicle to a location of your choice. We do all to keep you on the road. Enroll today.
It seems like AIA covers everything and truly simplifies your life. But something is missing. What about man's best friend? Well, we have that covered too. Pets are unpredictable. While it's hard to anticipate accidents and illnesses, our affiliations with Nationwide helps make it a little easier to be prepared for them. From preventative care visits to significant medical incidents, Nationwide provides protection for pets when they need it most. Nationwide policies cover a multitude of medical problems and conditions related to accidents and illnesses, including cancer. Coverage is available for dogs, cats, birds, and exotic pets. Plus, optional wellness care coverage reimburses for vaccinations, flea tick preventative, and more. Members are free to use any veterinarian worldwide, even specialists and emergency care providers. Best of all, members are eligible for preferred pricing, which makes this peace of mind protection even more affordable. You're free to use any vet, anywhere, receive preferred pricing as an AIA member. Also, our 24/7 vet helpline is available as a service to all pet insurance members, a $150 value. Tell a doctor for pets. That's right. All pets deserve to live life to the fullest. That's why we're there for the big stuff, the small stuff, and all the stuff in between. Enroll today. The AIA membership is the gift that just keeps giving. You earn AIA rewards just for being a member. Use your rewards to save on travel, gift cards, merchandise, and more. The savings are available to the primary member plus their dependents. Save up to 40% on hotels and condos worldwide. Enjoy 10% discounts on popular dining and retail gift cards. Get up to 80% savings on the daily deal. Save an average of 46% on software. Find deals on jewelry, apparel, electronics, cruises, and more. As a new AIA member, you receive $250 in AIA rewards in your own online account. Plus, an additional $50 in rewards will be deposited each month you remain an active member. To start using your AIA rewards, simply log in and start saving. Enroll today.
Now, just so you know, all that we have already discussed on this AIA is covered in the base package. The next two things we're going to talk about is add-ons, and then I'm going to give you a little bit more information on the health insurance side, and then I'll give you our coverage area, and then we'll pretty much be done.
Association RX. What if you knew the cost of your medicine before you went to pick them up? And what if those drugs were tiered and capped for your benefit? Look no further. Select our pharmacy add-on to your Simplify package. Our relationship with Association RX has a network that includes over 60,000 pharmacies throughout the U.S. The network includes national chains as well as thousands of independent pharmacies. To 65% savings on generic medications, with overall average savings of 40% across brand and generic medications combined. This program is designed to help you find drugs within the same therapeutic class as a drug you may be currently taking. Most of all, this program is designed to save you money on your prescription drug costs. This program offers 4 tiers of saving. Tier 1. The first tier is generic drugs that will be available to you for a payment of up to $10. Tier 2. The second tier is brand name drugs and select drugs that will be available to you for a payment of up to $20. Tier 3. The third tier is brand name drugs and select drugs that will be available to you for a payment of up to $50. Tier 4. The fourth tier is brand name drugs that we have negotiated special network pricing for you. For special network pricing, present your card at a participating pharmacy. You can visit www.associationrxcard.com for more details. Log on and check the price of the drug you are looking for and see participating pharmacies. To get the most out of this program, you should ask your doctor to prescribe a drug within the first 3 tiers if possible. Secure your pharmacy needs with AIA. Enroll today. Dental. Everyone wants that perfect smile and that amazing treatment plan. Add on dental to our Simplify plan today. Now, our members can save 5% to 60% on virtually all dental procedures. Since the dental program is administered by Carrington International Corporation, you now have access to one of the largest dental networks nationwide. Members will pay the discounted rate at the time of service. Receive unlimited access to care with no limits on the number of visits. The procedures range from cleanings and fillings to root canals and crowns. Savings on orthodontics are available for both children and adults. All dentists must meet highly selective credentialing standards. Visit any participating dentist on the plan and change providers at any time. You can smile again. Secure your dental options with AIA. Enroll today.
So that shows you that. Now let's kick out of here. Now we do offer those services that we just showed you the videos on nationwide, and some of them we even offer throughout Canada and the UK. But when we're doing benefits packages, we got special teams that we have help us with enrollments throughout the state of Mississippi, Tennessee, Arkansas, Louisiana, Alabama, and Michigan. And these teams are specially trained by us. They come in, they do the enrollment. We will work with you closely and stuff. You'll have, depending on the company size, anywhere from about 2 people to more, depending on your company size. We can handle any company that's 2 employees or higher in the employee count. The only thing that we ask and that we require, whether we're doing a cafeteria plan or not, is that we see all employees that's on the payroll. So we must see all employees. But other than, and not all employees have to take, but we have to at least sit down with them, show them what we got, and discuss with them. The next thing that I need to let you know is on the health insurance, we do have to have a promise of the employer contributing 50%, but the actual contribution that the employer makes, whether he says he's going to contribute 50%, 75%, or whatever, he doesn't have to. Nobody's going to monitor it. Nobody's going to be checking up on him or anything. So if he wants to pass the full health care cost on to his employees, he can. If he wants to contribute more, he can. So there's that. Now, as far as a benefits package, like I said, we offer these in the states of Mississippi, Tennessee, Arkansas, Louisiana, Alabama, and Michigan. We do have special enrollment teams that will come in throughout these states and enroll. They are specially trained by us. They know our policies on cafeteria plans, on everything. So they are very good. They're very professional. They will take as little time as possible with your employees. So we definitely highly recommend using them and allowing them to come in. You will first be talking to us. We'll get the group set up. We'll get all the quotes as far as once the censuses are uploaded and stuff. We'll get you quotes on what you're looking at per employee, per policy, and all, so that you can know. You can pick your policies that you want to offer, and basically we will run the enrollment. So basically, if we quote you an exchange plan, an alternative plan, and a different, and maybe two self-funded plans, you get to pick which plan out of that you want. We also got a couple companies we use for the supplemental health, and then we got basically tons of companies that we use to write the life insurance and the retirement, and basically it'll be based on which company is right for the employee with their health conditions and so forth. So with us writing a group on the life and the retirement, if we do annuities, it's not guaranteed issue, but the plus is it's portable. And with it being portable, that means that if they were to, for some reason, leave you, they can take it with them. And we can have it where it's properly funded to where, depending on the policy they get, they would have multiple retirement options and multiple ways of getting help and stuff if they have a health event and so forth. So just keep that in mind. You can call us at 662-912-3914. Again, that number is 662-912-3914 to start the process on finding out how much a health and benefits package can cost you, and not only how much it can cost you, how much it can cost your employees, and the benefits of it in the full range, and basically start the process on getting set up with a good, affordable benefits package that your employees will love and that will benefit your employees for a very long time. Thank you and have a nice night.